I was born and raised in Bulgaria. I remember actually deciding to become a physician in second grade. I did my residency at Vanderbilt, then followed by a fellowship at Emory University, the subspecialty of interventional pulmonary. Lung cancer is the #1 cancer killer, and it kills actually more people than colon, prostate, and breast cancer combined every year. Within the past decade, there have been significant improvements that have allowed us to diagnose cancer at an early stage, which allows it to be addressed with a curative intent. We now have a procedure that allows us to biopsy very tiny lesions within the lung that are barely visible with a naked eye on a CT scan. But we have now the precision and the confidence that we can reach those lesions with a procedure called robotic assisted bronchoscopy. I control the robotic bronchoscopic arm with a console, and I'm able to make very fine movements and turns into sometimes very difficult to reach areas. Robotic assisted bronchoscopy is incredibly safe, and there are actually no incisions that are being made throughout the procedure, which allows for very quick recovery, and patients are usually back to normal that same day. Another thing that I'm very passionate about is lung cancer screening. A lot of people are not aware that there is actually a test offered as a screening tool to detect cancer early. It involves an annual scan with a low-dose CT scan, which is very similar to how women get an annual mammogram. Right now, unfortunately, our screening rates are very low just because a lot of people are not aware that this is a tool and a screening test available to them. So I strongly urge patients who are current or former smokers to talk to their doctor and to see if they qualify for this preventative screening test. I think there was a big change in my perspective and how I viewed patient care when I was a patient myself and when my father was diagnosed with lung cancer, which was one of the biggest bittersweet ironies of my professional career. That gave me a very different perspective on how to communicate and how to advocate for patients on a very different level. I thought I had empathy before, but that experience taught me so much more. My commitment to quality of care is that I want to treat them like they're my family. When I started training in interventional pulmonology about a decade ago, I would not have thought that we would be able to do the things that we're doing currently. There are currently therapies being developed about being able to deliver therapy directly inside the lung without any external radiation or any systemic treatment such as chemotherapy. So I am really excited about what the future holds, and I hope to see even more advancements and progress within my professional lifetime.